Mechanism of action, which we've already discussed, is to inhibit that sodium and chloride reabsorption. And again, if we're inhibiting sodium reabsorption, we're keeping more sodium in the nephron or the tubule, and therefore water is following that, and that is going to decrease fluid overload. So it's going to decrease the volume of fluid that's in the vasculature, in the systemic circulation. So that's why the primary indication of loop diuretics is for edema. They may have a little bit of effect on blood pressure, but the effect that they have on blood pressure is really due to the volume depletion. So if a patient that is volume overloaded, so their blood vessels have excess volume, that's going to obviously increase pressure in those blood vessels and increase blood pressure. So therefore, if I decrease the amount of volume that's in those blood vessels by using a loop diuretic, then you are going to have a decrease in blood pressure because you're going to have a decrease in volume in those blood vessels. Loop diuretics, as compared to the other two diuretics other two classes of diuretics that we will discuss, have a more potent effect on decreasing edema. So in the presence of edema, loop diuretics are generally your first option, especially if there's significant fluid overload, especially due to chronic kidney disease or heart failure. Renal considerations. These agents are actually effective in patients with a creatinine clearance less than 30. When we talk about the other agents, the other classes, you'll realize that we do have some that we have to consider stopping when the GFR or creatinine clearance drops. However, loop diuretics can continue to be used, and oftentimes we substitute a loop diuretic for one of the other diuretics once the creatinine clearance drops below a certain level. However, in your dialysis patient population, these agents are not going to be effective unless they have some residual kidney function. Just again, thinking about the site of action and the mechanism of a diuretic. The site of action is the nephron, and it works by eliminating excess fluid and controlling those electrolyte balances. In order to increase that fluid excretion, you have to have a functioning kidney. So if you do not have a functioning kidney or any functioning nephrons, a loop diuretic is not going to be effective. So while it would probably be safe to use a loop diuretic in a patient with dialysis, you're really not going to get any benefit. And again, there are some patients on dialysis that do have some residual kidney function, so you will see some patients on dialysis still on a loop diuretic, but those patients are fewer. So ADRs, just thinking about the mechanism, if we're inhibiting sodium reabsorption, you're going to be at risk for developing low sodium. Also, along with that, you're going to have a risk of hypokalemia and hyperchloremia. Again, back to the mechanism, inhibits chloride reabsorption, so the risk is developing low levels of chloride. Something also important to note is hyperuricemia.